Each year, cardiovascular diseases continue to be the leading cause of death globally. Roughly 32% of all deaths worldwide are caused by related illnesses, with low-income countries such as Belize being highly susceptible to these diseases. Diet and lifestyle choices play a major part in the prevalence of these conditions, and Belize has struggled to overcome these challenges year after year. To combat these statistics, the Hearts Initiative was introduced to Belize through PAHO in collaboration with the Ministry of Health. The initiative was implemented locally in the Western region first and is now in the Central region. Today, members of the healthcare sector gathered to participate in a workshop that will guide them on how to use Hearts strategies effectively. Dr. Fidel Cuellar, Deputy Director of Public Health and Wellness, explained what the Heart Initiative encompasses.
What Hearts is, it is a package, various packages that are geared towards addressing risk factors for the biggest reason of death, really, in the Caribbean and Belize, which is cardiovascular deaths. So what we're saying is that we understand that people are dying of hypertension-related illnesses like stroke, heart attack, chronic kidney diseases. Hearts is going to help us to address this problem, to be able to control hypertension and diabetes the way it should be. Unfortunately, the majority of people who have hypertension, they do not have it properly controlled. And then that leads ultimately to your strokes and your heart attacks. And that is why Hearts is very important for us in Belize.
Cuellar acknowledged that cardiovascular diseases have continued to be the leading cause of death in the region, despite previous attempts to combat its prevalence. He explained that the Hearts Initiative is taking a dynamic approach across various aspects of the healthcare sector to combat the condition from several angles.
So what Hearts is doing is putting very clear, easy protocols in place so that the physicians, the nurses, and everybody can get on board. For example, right now in Belize, if you're just diagnosed with hypertension, depending on which doctor you go to, you will have different medications. The Hearts data shows that that doesn't work. You need to be on a specific set of medications for a specific set of time, and it needs to be adjusted in a specific way. So that in itself is a big difference. The other difference is the way we approach hypertension. Traditionally, we use manual cuffs, or we don't use validated devices, and everybody does it their own way. Having people do it one specific way helps us to determine who is hypertensive and who isn't, and if you're hypertensive, what is your true number. So these are major changes in the way we approach hypertension and the way we treat it.
The Hearts Initiative was launched in 2016 by the World Health Organization and the United States Centers for Disease Control and Prevention, with other partners, to support governments in strengthening the prevention and control of cardiovascular diseases. Dr. Karen Lewis Bell, PAHO representative in Belize, explained how the initiative found its way to the country.
The Hearts in the Americas initiative, which was launched in 2016, now has some 33 countries in the region of the Americas implementing this. Belize implemented it in October 2023. They became the 25th country in the region to implement this. And I really want to give kudos to the Ministry of Health in recognizing the importance of ensuring proper and comprehensive management of hypertension and diabetes as part of this initiative. And so PAHO is providing the technical cooperation in terms of training, capacity building, helping to provide clinical guidelines, as well as helping to provide some of the equipment in terms of, the clinically validated blood pressure machines that the health facilities will use to measure high blood pressure, etc. And we are really getting some funding support from the European Union for this workshop that we're having today and to help to roll out the Hearts Initiative.
Dr. Bell reiterated that the approach of Hearts is complex, starting at the primary level before working its way through the sector. She said that it has displayed successful results in other regions that can be replicated in Belize with the right approach.
And so it's a comprehensive package of care, and we do it in an integrated way, focusing on the first level of care, what we call the primary health care. As you may know, in many countries, in fact in all countries, the first level of care is where the individual or the patients will first interface with the health system. And so we have to work at that level, at the village level, and to make sure that everybody understands and is doing the initiative in a structured way. And so with this, we are building capacity so everyone is on the same page with the knowledge of what to do and how to do. But in addition to that, the countries that are further advanced in the implementation in our region have actually shown significant improvement in the control of these conditions. So hospital admissions will be decreased. The complications that you may have, like amputation, strokes, heart attacks, will be decreased. And ultimately, we will decrease the deaths from these conditions.
Britney Gordon for News 5.